Greetings, everyone, and thank you for joining me on this episode. On this podcast, we talk about all the important topics of interest to public health professionals who are at this intersection of entrepreneurship and public health. And I'm excited that you've decided to join us on this episode or any episode. I'm always happy about that. My name is Dr. Charlotte Huntley, and I'm your host. I'm a public health entrepreneur with over 20 years of experience in both healthcare and public health. And I've helped a lot of entrepreneurs along the way. I'm delighted to bring this podcast to you. Now, although it's a new podcast, I've been podcasting for a long time, since 2017. This episode is actually a result of a question that we received around funding. It was a request. Can you discuss funding? And I thought that is such a public health kind of a term. And usually people that come from a government or nonprofit background and are thinking about entrepreneurship will think about funding. So that's kind of loaded. So I'm not sure exactly what is meant. What do you mean by talking about funding? We could go in a million directions. So I decided to kind of focus the niche it down to talking about ways to monetize as an entrepreneur. So back in episode number 2, I believe it was, I answered the question, what is a consultant? What is a public health consultant? If you haven't listened to that one, please scroll back to the title is What is a Public Health Consultant? And I think that would be very helpful. Maybe both. What is a public health entrepreneur and what is a public health consultant? I think it was episode number 1 and number 2. They're right there together because it really puts everything into context. And I won't repeat all of that, but I'm going to go kind of give you a few different ideas about how you can monetize as an entrepreneur or as a consultant, and how you're providing services and being able to charge for what you do. And you come to the table with a lot of expertise. So many of you have varied backgrounds, or maybe even if you've worked in one particular area for a long time, you still bring a lot of expertise to the table as an entrepreneur. So you have options. This a few examples just to kind of get you thinking and get kind of your mind sparked, is what I'm hoping to do here, to get you thinking about some of the ways that you can provide services, solutions to maybe seeking these type of resources and help from you, and be able to charge for those services. So let's dive into a few of these examples. One of the things that I want you to think about is under this area, or in this area of health education and training, which, I feel like all of us, we could all say yes to these things, but you could offer things like workshops or seminars, community level. I've talked to so many consultants who do, they offer community level events, or they facilitate or organize these events, and they partner with other agencies or community organizations to provide these types of seminars, classes, workshops, even online. They could be in person or online. And those are great ways. Sometimes you've maybe done these types of things as your job responsibility in a previous role. And now you could take those services and you could bring that to a business and offer that as a service through your business. People I've known have done really well with online courses, including myself. I started very early on with online courses, and I love that because it was an opportunity while I was still working a full-time job, before I was full-time in my business, before I even knew where I was going with the business. But people were asking about coaching services, and I would meet one-on-one, but I found that to be not really sustainable for me in the schedule that I had. So courses worked really well. It gave me an opportunity to put that in some of this, especially when a lot of people are asking the same types of questions in my coaching, business coaching sessions or career coaching sessions. I created a course around some of those commonly asked questions, and online courses was a great way to kind of reach that for coaches, but then also for, sticking with this health education and training. If you partner with organizations that want to teach or train members in the community or even their workers, you can provide online courses for these organizations, or in partnership with these community-based organizations for the purpose of health education, or, like I said, training if it's like for the employee or team members. You can also focus on, I like this, my background is healthcare and public health. So I always look for these opportunities, and I gravitate to these opportunities to bring those together. So you can partner with healthcare as a public health professional to create and deliver really robust solutions that pull together, pool, I should say, POOL, pool together the healthcare and the public health elements into these really robust solutions. And that's a great opportunity, especially in today's times. People are really looking for that overlap and that opportunity. So those are just some ideas for you. It could be focused on general public. It could be around disease prevention, about healthy lifestyles, and even around policy, like healthcare, public health policies. So those are just some ideas and some thoughts around how you can take your expertise as health educators and in training and monetize those. So not really thinking of funding, but thinking about how you can monetize your business. So I'll go a few steps further. When it comes down to those are things that you could do, solutions you can offer, and thinking, okay, well, where do I find these? You can start going down directly with connections and relationships you already have with government organizations and these community-based organizations. Have those conversations that could lead to sales, conversations where you work out you provide a proposal and you agree on the terms and you have a contract and you do the work. That's one route. You can also go the route of looking for these RFPs that are submitted. If they're right, sometimes they're looking for people that can help with these projects. You can respond to an RFP that way. You can also go the contracting route, and you can look to contract, go through working directly with federal government, which are several steps and a whole nuanced process that you would need to follow. But there are multiple routes you could take depending on your preference. It's your business, right? You're designing and creating and building the business of your dreams. Or you could have a mixture where you have some of these a pipeline coming through federal government contracts or maybe state contracts, and then maybe a mixture through community-based organizations. Something along those ways, along those lines, some things to think about. Okay. Another idea for you, in addition to health education and training, is public health research. One of my favorite entrepreneurs is a public health researcher, and her whole consulting business, her focus is public health research. Maybe I can get her on this podcast. I'm looking to bring on some guests here pretty soon to talk about what they do to give you some inspiration and some real life examples. Right now, I just want you brainstorming a little bit if you're thinking of getting started, or this can help you niche down if you've already gotten started. Because usually when you started already, you're kind of doing a little bit of everything until you can kind of niche it down. But public health research is an area, if that fits you, you can partner with government agency, you can get grant funding, you can work with private foundations, academic institutions. You can monetize your research expertise, in any step of the process, from working with the communities, gathering research data, to all the way to publishing papers, and just anywhere along those lines you can offer your expertise as a consulting service, and a solution to the client that's looking for that type of help. Right. And let's see, I'll give you a couple more examples. I think it's worth considering, depending on your background. Like I started to touch on this earlier, but healthcare and public health management services, depending on your background, because again, I overlap in both, you may be able to provide some solutions to healthcare facilities or public health agencies, where you're helping with, maybe it's just operations, performing, like if it's on the healthcare side, it could be something related to patient healthcare outcomes, lifestyle, teaching, coaching, trainings, those types of services. Those are really popular. And again, it's that intersection and that overlap of public health and healthcare coming together. And I think it could go a really long way to helping to, if you work, for example, with, say, a healthcare practice, and so they're addressing these challenges of chronic disease. Maybe their patients they have a lot of patients who are, have unmanaged, uncontrolled chronic conditions. And they partner with someone like you as a public health professional, and you're providing these type of services. Maybe you could provide the education, the training to their patients. And that's an example of a collaborative that's under this kind of healthcare public health management kind of a collaboration. I think that's something worth considering, exploring for some of you, especially depending on your background. So some of you may be listening going, That makes a lot of sense because it resonates with some work you've been doing. People that have been in, say, nursing, for example, you may have a lot of ideas as you're listening to this. So those are just some things to think about. I think another thing that for some people that would be great is health advocacy, and you can advocate for public health uh, policies on any level, local, state, national, even internationally. You can, those of you that really identify as passionate advocates, you can find that organizations really will be drawn to your expertise in the services. And especially if your interest in what you're offering aligns with their goals, it could be a great way for you to, a direction to go into. And the monetization pathways could stem from anything from grant funding to, again, private foundation, just all sorts of funding sources. But the key is that your solution and the work the service that you're providing to that organization, they will have the funding sources. So you're just contracting with them. They will get, they may be funded through, say, a federal grant, but when you contract with them, then they're going to pay you for whatever your fee is for the services that you're providing. And I guess the final thing I'll add here is don't forget about the global health initiatives. I think that there's such an opportunity for engagement in international public health opportunities and projects, both, not just across directly with other countries, but even thinking about within the United States or wherever your country is, if you're listening from another country, there's the opportunity because of how global people are traveling, coming and going all the time. So if you're in, say, a large city, say like New York City or Washington DC, those are very global cities. So you can bring these opportunities and you can look for these opportunities for global health initiatives within even a city here. I know of an entrepreneur who is really looking to target immigrants in her city, and she lives in the north, one of the northeastern states of the United States. So even within your country, you can look for these global health initiatives or opportunities because those challenges are real and the opportunities are there. And I think you may have to get creative in how you search for them. But if that is part of your background or training or part of your passion, then that's certainly an area that you can target for consulting services. So I hope this gives you some ideas, some bits of inspiration, some things to think about. And as a reminder, I mentioned this previously, but we do have a Mastermind Group program, and it is exclusively for public health entrepreneurs where we work together online and also gather together in person for a 2-day retreat, and it happens twice a year. We've had entrepreneurs travel from the UK, from all over the US, and we've even had member travel from Guam to attend our in-person retreats. They are absolutely delightful, wonderful, impactful. You walk away with such an abundance of support and encouragement, inspiration. You're ready to hit the ground running, clarity, answers. It's a true refueling in that sense. And then, of course, our in-person events, our experience is wonderful. It seals things between those in-person meetings. But I really encourage you to explore our mastermind program. Enrollment is only open twice a year, and it's open in June and December. And we only take people or only consider people who have submitted an application. So if you want an opportunity to enroll, you will need to apply so that we get a chance to meet with you, make sure all of your questions are answered, and to make sure that it's a mutually good fit, our program with you and the others that are in the program now. I'm excited. So you can find all that information at our website, which is publichealthentrepreneurs.com. When you're there, just click on Mastermind, and there's a whole page of all the information at the bottom. You're able to click and apply. Okay, as we wrap up, I would love to ask you, in addition to exploring our mastermind program, I ask you to help us share the word about this podcast. You can share directly from one of the podcast apps that you may be listening in right now. You can share our website with a friend, which is publichealthentrepreneurs.com. And another way is to write a favorable review in Apple Podcasts. That would really brighten our day. And that's the highest encouragement. And it really helps people to decide, whether or not this is worth taking a time to listen. And, we all are fueled by reviews and it matters. So we appreciate you if you've already done that. And we ask you to do that to help us to grow this podcast and to share the word. Whichever option you choose, I greatly appreciate you helping in whatever way you decide. All right, everyone. Until next time, have a fantastic rest of your day.